My name is Heidi, and today I will be performing a REMOM with a 68-year-old male whose main goal is to improve his golf game. Some deficits that my patient is experiencing would be lack of flexibility in his trunk and his shoulders that he's definitely noticed throughout his golf swing, so he's wanting to improve that golf swing especially. There is some decreased endurance there, balance deficits, and grip strength is less than ideal. So to jump right into the REMOM, I want to start with a 5-minute warm-up. So every exercise is going to be 1 minute long, and I will incorporate rest breaks as my patient needs. Or if he's not taking any rest breaks, I do plan every 3 exercise to allow him to take 30 seconds to catch his breath and maybe get some water. So again, to start with the warm up, we are going to just walk around the house for that minute, just to kind of get the blood flowing, get that heart rate starting to increase. And then next, after that walk, we will start with some D2 flexion and extension with a forward step to really work on activating those shoulder muscles, open that chest, taking nice breaths in, and working on that weight shift forward while moving the arms. So kind of that multitasking aspect. Next, I want to have him perform some bird dogs with head turns. So each time he moves his arm and leg, he'll turn his head the opposite direction, and that is going to work on his core strength while also incorporating some dynamic head movements, so that can kind of throw him off his balance. So that'll really start to focus in on that core stability while balancing with the shoulders engaged, all that good stuff. Next, I want to do some standing hip mobility. So we're just gonna have him rotate his hips laterally for a full minute, just really starting to warm up the hip joint and all those muscles involved there. Lastly, for the warm up, I will have my patient do some lateral weight shifts and then lift that contralateral foot. So I'm gonna have him step to the side and pick up his foot, holding it for about 3 seconds, and then we'll shift to the other side, pick up that foot, hold that for 3 seconds. And that will conclude the warm-up. Next, we will begin the exercise portion of the REMOM. So focusing really on his main goal, which is to improve his golf game, improve his swing, and just get that flexibility back that he said he used to have. So we're gonna start with that cross body stretch, really working on that posterior capsule to help improve that backswing during the golf swing. So yeah, we're gonna hold that. First arm will be 30 seconds, and then the other arm will be the last 30 seconds. Next, we'll do the thread the needle. This is really gonna focus on mobilizing the thoracic spine, getting that rotation component, which is needed for golf swinging. And let's see here. Yeah, again, really focusing on that thoracic mobility. Next, I want to start to really work on that core some more and the obliques. So we're going to attach a TheraBand to the wall in a door, and we're going to focus on trunk rotations with that TheraBand on both sides there. So we'll do 30 seconds on one side and then 30 seconds on the other side. Again, focusing on that rotation component, so the mobility, and also starting to strengthen those obliques and the core. Next, I want to do some balance work. So we're gonna stand on a mini trampoline that he has here at his house, and I will apply some perturbations at his hips, and that will really help work on his balance, especially since it's gonna be on that dynamic surface, also while having those perturbations, really just helping to engage all those stability muscles. Next, after that, we are going to work on grip strength. So I want to work on both extension and flexion. So we're going to use a rubber band around his wrists, around his fingers, and just have him focus on opening it. We use one that's not so springy. Focus on opening the fingers there, and then we're going to use a stress ball for him to grip, working on those finger flexors. And this will help with holding the golf club with lots of control. And yeah, grip strength is really important. We know that that is the sixth vital sign. So, well, that's what people are talking about. Next, after grip strength, we're gonna work on a lateral step and then reach, focusing on that hip rotation towards the side he's reaching with a shuffle back and then reach to the other side. That will work on the endurance because we're going to be doing that for a minute with the shuffle aspect in between each lateral step and reach. We're also going to be working on that shoulder range of motion, trunk range of motion, as well as that hip rotation, which you really need for the golf swing to finish that swing all the way through. Lastly, after we did all those build-up exercises, we're gonna go outside in the grass and get his golf clubs, have him hold his golf club, and really focus on a slow and controlled swing. So we're gonna focus on the back swing, rotating, making sure the shoulder is in line where he needs it, slowly swinging down and following through, focusing on that weight shift and pelvic rotation. And then once we're done with all those exercises, each for 1 minute, we're gonna do the cool down. So we have 5 exercises with that. We're gonna start with doing child's pose into upward dog, really focusing on that trunk flexibility, also that hip mobility. After that, we'll do a supine knee to chest, still focusing on getting those hips loosened up. Next, we are gonna work on thoracic extension with the hands behind the head, focusing on breathing. So I'm really wanting to open up that chest, bring that T-spine into extension while breathing out, coming into flexion, working on nice big breaths to help slow the heart rate and really get good oxygen in with that cool down. After that, I want to do a straight arm wrist stretch. So we're just gonna hold that there, 30 seconds on this side, 30 seconds on the other side, and then ending with the wrist extension stretch, like that. All right, so my 68-year-old patient actually went out of town, so I'm gonna be demonstrating my REMOM on my friend, Andy. And we're gonna start with the warm-up. So to kick off the warm-up, we're gonna walk around the house just for a minute at a comfortable pace to get that heart rate going. We're gonna work on D2 flexion and extension with a step forward. So I'll demonstrate and then you can follow. So we're gonna go like this, step forward, and then come back. And then we're gonna step forward with the other leg and come back. All right? I'll just be right here just in case. And back, step forward, come back, forward, back. We'll do this for a minute. All right, now we're gonna do the bird dog. So you're gonna be in quadruped on all fours. And what I want you to do is just start with lifting your arms up like this. Can you do that?
Yeah.
And then we're gonna add in a head turn. So when this arm is up, you're gonna turn your head away and come back down, and then turn your head the other way and come back down. And if that is too easy, then you can add in your opposite leg. So you can have this arm up, and then your back leg up, and turn your head and come back down. And the other way. We'll do that for a minute. Now we're gonna work on some hip mobility. So we're just gonna stand with our hands on our hips. We're gonna roll our hip out like that. Each side. Good job. Another minute. Doing great. We're gonna finish the warm-up off with some balance. So we're going to shift our weight to one leg and lift the opposite. We're gonna hold it there for 3 seconds. Good. And now we're going to shift to the other side, pick up your leg, and hold it for 3 seconds. Shift again, hold. Great job. The actual exercise portion of the REMOM. We're going to start with the cross body stretch. Pulling your arm across. We're going to hold that for 30 seconds. And then we're going to switch arms for the last 30 seconds. Okay, now we're going to get back on the ground into quadruped and do what's called thread the needle. So you're going to lift one arm up and go up towards the ceiling and then back down towards your opposite arm. up towards the ceiling, down towards your opposite arm. And we'll do that for 30 seconds, then switch sides. We're gonna work on TheraBand trunk rotations. So you're just gonna hold on to your band like this, with it in the door. You're gonna keep your arms straight and turn to the side. We'll do one side for 30 seconds, and then we'll turn around and do the other side for 30 seconds, okay? How's that feel?
Good.
Perfect. We're gonna work on your balance some more, so I want you to stand there. The chair is there if you feel like you need to grab onto it, but I want you to try and keep your hands off of it as long as you can, and I'm just gonna apply different perturbations to your hips, okay?
Okay.
How's that?
Good.
Good job. Now we're gonna work on grip strength. So we're gonna start with just finger extension. So you're gonna have this hair tie around your fingers, and I want you to open up your fingers and relax. Open and relax. Great job. We'll do 30 seconds on this hand, and then we'll switch to the other hand and do 30 seconds. We're gonna work on finger flexion and grip strength. So we have this stress ball. I want you to just hold the stress ball and squeeze it as tight as you can, and then hold the squeeze for 2 seconds, and then relax. We're gonna do 30 seconds on your right, and then 30 seconds on your left.
Okay.
Great. Now we're gonna work on kind of a sequence of exercises. So I'm gonna start with having you reach to one side, focusing on your hip rotation, and reaching that arm out. And you come back to center, shuffle your feet, and then reach to the other side, focusing on that hip rotation or shoulder extension.
Okay.
Got it?
Yep.
We'll be back here.
Rotation. Back.
Shuffle. Focus on that hip rotation. Good job. Good job. Other side. Do this for a minute. Finish the exercise portion of this REMOM with practicing your golf swing after we did all those exercises. So I want you just to take it nice and slow how you normally would stand. We're going to focus on that trunk rotation that we worked on and that shoulder mobility at the back here, slowly coming down and rotating those hips to follow through. Okay?
Okay.
Just take it nice and slow. Your trunk rotation, elbow, slowly coming down, rotating the hips. Great, how does that feel?
Good.
Good, we'll do that for a minute. We're finished with the exercise portion, or the main portion of the REMOM. We're gonna do the cool down. So we're gonna be back again on all fours. We're gonna sink back into our hips and do what's called the child's pose. We'll hold that there for like 3 seconds, and then we're gonna come back up and do upward dog, bringing our hips down. And look up, hold that, and then we're gonna come back and sink into our hips again. And then back into that upward dog. Great job. Now we're gonna do what's called supine knee to chest. Great job. So you're just gonna lay there, relax, and hold your knee to your chest. How's that feel?
Good.
We'll hold that for 30 seconds, and then we're gonna switch the leg. And hold it for 30 more seconds. Next is the thoracic extension. So I'm gonna have you sit in this chair, arms behind your back, or sorry, behind your head, and you're gonna extend back over the chair, taking a deep breath in through your nose, and then you're gonna come forward and breathe out. And you're gonna breathe in through your nose, and come forward and breathe out. Okay? Arms behind the head, breathe in, and breathe out. Great job, Andy. And the cool down with some wrist mobility stretches. We're going to start by just bringing your arm out in front of you and pulling that hand down towards the ground like that. Does that make sense?
Mm-hmm.
We're going to do that on each side for 30 seconds. And then we're going to flip the hand and pull that back to you on both sides for 30 seconds.